صباح الخير جميعا. لو سمحتوا هدوء لأنه عندنا الآن محاضرة عبر الأونلاين، فأهلا وسهلا بكم بصباح يوم جديد، يوم مليء بالعلم والمعرفة وجمال الطبيعة. الآن راح نرحب بالدكتور أحمد كتكوت لمحاضرته القيمة All Shapes the Future of Prosthodontic.
السلام عليكم، سامعني؟
ايوه تفضل دكتور. اهلا وسهلا فيك، مرحبا، سعداء جدا بان نلتقي معك عبر الاونلاين لنسمع منك الكثير من المعلومات المهمه والمفيده في مجال طب الاسنان.
شكرا جزيلا لكم على الدعوه الكريمه. Thank you so much for the invitation. The title is Artificial Intelligence AI Shapes the Future of Prosthodontics. First of all, I would like to thank everyone for coming and inviting me to share some knowledge with everyone. I know the time is different, like 7 hours, about 2 a.m. in the morning here, but inshallah we'll do it. So I'll be presenting a lot of digital component in terms of systems and scanners and softwares. So I don't have any conflict of interest. And in order to implement the new knowledge, I think you need to be careful with the knowledge needed. So the purpose of the presentation today is to look into the integrating artificial intelligence, AI, into prosthodontics, crown, bridges, dentures, implant. And the implant is heavily involved in this process. So technology is great if it works, but if it doesn't work, we always have some challenges with the technology. So this So we always need to be prepared for facing the challenges that we need with the technology that we need to use. So the presentation will be very short, I think 20 minutes. I'm not sure if I can finish everything in 20 minutes, but I'll do my best to cover the background, decision-making process, clinical implementation, and some recommendation at the end. So what's the AI, the artificial intelligence? So it's the ability of the machine to perform tasks without human guidance or somebody to operate that. So the AI, the artificial intelligence, is designed to analyze data and use it to make prediction and decisions without being programmed to do so. And that's the scary thing about the AI. So we have to be like very, very careful implementing that in treating in the patient treatment. So in the literature, we have a lot of evidence with AI in dentistry, and it's mainly in the radiology phase, the diagnosis and treatment planning phase. And it's getting more and more in robotic performing the procedures. So the models that are presented in dentistry with AI is highly accurate, and we need to look for further studies with randomized control studies to confirm the validity of the AI. So the AI results from the large quality data. It comes from algorithm and learning and trained models. So we have two ways of training the machine learning process, either by example or by supervision. So this video will show some of the how the human can train the robot to perform the task. So this is by example. This is how the robot can do the function. So it's improving every day and it's making the change. So basically, we will see AI invading dentistry in all fields, mainly in digital diagnostics, radiology, and treatment planning. And if you look at the percentages, including implant 5%, pros 2%, restorative about 12%. So it's getting up to 20% when it comes to the restoration, scanning, and planning your surgery or for restorative work or for any dental work that needed. If you look at the publication AI in dentistry, you will see more than 2,000 publications in the past 3 years. So there is a lot of interest in the AI. And if you look at the implant itself, the implant dentistry, surgical guides and guided surgeon, robotic surgery, it's about less than 200 publications in the past 3 years. So where do we see the digital technology? We see it in the scanner for diagnosis and treatment planning, for designing the planning software, the CAM manufacturing and designing equipment, then static and dynamics computer-aided implant surgery, and we're going to highlight on that area a little bit in the end. So the digital technology, what we need to have CBCT for treatment planning, implant cases, comprehensive cases. We need intraoral scanner, sometimes facial scanners or disc lab scanner to collect the impressions or scan the impressions and start with the planning phase. When we do that data collected, now we look at the designing software like Smile Design or implant treatment planning, implant position and prosthetic design, and finally crown restoration design. So that's the software that needed. Then the manufacturing technique, we have either the milling machine or we have the 3D printing machines. So these are the phases of the digital technology, and this will come in steps. If we need to do the intraoral scanning, we have to outsource most of the production of the cases. If we have the 3D printer in-house, like in your practice, in your office, you can print guides, you can print temporary denture, temporary restoration, and you can outsource 80% of the final processes that you need to do. And if you have a chairside milling machine, you can do 50-50, CAD-CAM, production, crowns, bridges, and you can outsource complex cases and big cases like dentures and overdentures and full arch zirconia and hybrid. Then if you have in-house a lab milling machine, then you can do most of the lab work in-house. We outsource only 10% of the cases where you have all-on-4 or complex cases. So it's computer assisted or aided design and manufacturing that require an intraoral scanner, optical scanner, software design, and 3D printing or milling machine. So as we know, for implants or any pros cases, we have to do either physical impression using PVS or polyether, or we can do it digitally to scan for the implant restoration or for crown or tooth or bridge restoration. And in order to make this, accurate, we have to have dry fields. So dentistry in general will not change if we need to change the tool from the PVS to the intraoral scanner. And that will make your life much easier to replace for study models, all the alginate, all the plastic trays, agar or alginate substitute material with a digital scanner only. So that will minimize the need for stone, pouring cast, and fabricating these models. And we can replace all the material that we need to produce working models or casts for final prosthetics like PVS or polyether or polysulfide with only scanner, 3D printing, and milling machine. So we can replace a lot. And we know the problem with the physical impression. So we see a lot of patients, they cannot tolerate any material in their mouth or dentures or anything. So now the scanner will be an excellent replacement for these patients who have gagging reflex and they cannot tolerate anything in their mouth. So the scanners became much better than before, much smaller, wireless, fast, and accurate. And you have like automated design software. Also, you will see the workflow much easier, more restorative material available from the temporary acrylic to zirconia full arch or ceramic material. The precise fit, the quality of the production, the anatomy, the contour, way higher than the traditional way we do. And nowadays we have it supported in AI with a high accuracy in production. If we look at the data like 10 years ago, we have up to 15% of dentists who use the digital technology. Like in the past 4 or 5 years, according to the ADA, the American Dental Association, 53% of dentists using the digital impression for what? Better outcome, improved efficiency, improved patient education, reduced chair time. So all these benefits of using the digital technology and mainly used for simple single restoration, and they receive the training either from the manufacturer or from the CE continuing education courses. So where we see the AI in the crown production, it will increase the efficiency. Now, once you scan for the implant or once you scan for the tooth, you will see the AI marking the margin and building the crown, the virtual design of the crown. So what you need to do as a provider, you just need to verify the margin, then you can send for production. So it's very accurate in most of the time. However, most of the studies are small number of samples, and we need to look to standardized protocols in this workflow. So the digital impressions with AI support resulted in a time efficiency. It's double the time, cut the time to the half compared to the traditional analog technique, and most of the patients prefer the digital workflow than the traditional analog one. So now we're going to look at the decision making. We have plenty of option of scanners or 3D printers or milling machine. So what we need to do to pick the appropriate one for our practice. The key factor here is the knowledge. Once we gain the knowledge and we know the differences between different scanners that are available in the market, from Stroma to Dentsply Sirona, Plan Mecca, the iTero, the 3Shape, and the True Definition, you will see these are major scanners that's available, and it has AI support. So when you scan, if you by mistake scan, the scan go over your finger or the tongue or the cheek, the AI will eliminate unnecessary impressed area. However, you will see other scanners like Medit 700 or other Carestream. These are like less popular and less accurate, and not all of them, they have the support from the AI for the software to help out in the treatment. And when you need to pick the scanner for your practice, you have to look at the price and the features. And based on the literature we have, the most accurate scanner for fixed and removable prosthodontics, including implant, is the 3Shape trial scanner. And that's based on the literature. And you can see the change in the size from the big to the small, and the wire and the wireless type of scanners. So we need to learn about the scanner before purchase it based on your practice and what you do in your practice as fixed or removable. So now we're going to move to the clinical implementation of this technology. So in order to do the treatment planning for an implant case, for example, what we have to do, we need to have the CBCT and the intraoral scan. And you can see in this image is indicating for the CBCT where you see the bone, and you're gonna plan the implant as virtual implant position here. Then you're going to have the superimposition of the intraoral scan with the virtual wax up. So these are the components that we need to start the treatment planning for any case in implant dentistry and prosthodontics. Then you can design your guide and have it 3D printed. When it comes to the treatment planning phase, you can see the software with the AI support can extract the teeth, separate the teeth, segment the teeth from the maxilla and the mandible, trace the nerve, be able to plan the implant position based on the crown position as prosthetically driven treatment, and determine the mental nerve, the sinus floor, and all of the landmark area. The AI will help in the patient segmentation, coordinate system, panoramic curve, and nerve detection, and the STL alignment. It's very important to verify every single step of these. This is the segmentation. We have to make sure it's parallel to the horizon, aligned with the midline, and in the appropriate orientation occlusally. Then we have to look at the panoramic curve, and we need to can make adjustment. You can move any of these dots to make the adjustment for your case. And all of that will be done by the AI in a few seconds. Then you can look at the nerve detection, the nerve canal, and the mental foramen. And final step that you need to verify is the alignment of the intraoral scan to the CBCT scan. And you can see the color here. You can look at the cusp tips, the palate, all areas from the sagittal view, occlusal view, and the superimposition. And once you confirm everything, you can start evaluating the implant site, epicoronal position, buccolingual, and mesiodistal. So we have to look at the whole area, not only for the bone, but also for the soft tissue. So you can look at the soft tissue thickness in the interest area, and you can plan for your implant placement with the temporary or with the healing abutment or submerged. And area of the AI can improve with time what implant we can select for the case, which best implant bone level versus tissue level, or zirconia implant or aggressive thread design implant. So which implant can be utilized for this? So we need to give the computer system a lot of data to analyze the cases and be able to suggest the implant for your case. And for example, here, if you're going to fit an implant in this alveolar ridge, you're going to position it in that way, then the long axis of the implant is coming from the facial surface, so that's not a good position. So we have to move the implant to have the long axis of the implant coming from the incisal edge. Then we can do like custom abutment and cement retained crown. But if you want to plan for a screw retained crown where you're going to have the long axis coming from the cingulum area, then the implant is outside the ridge. So which implant position will be the most beneficial for the patient? So we need more help to train the software to be able to position the implant and suggest what we need to do in terms of grafting and membrane. So these are area of improvement. And we can look at the different ways of doing the surgery, static versus dynamic. So we can do virtual extraction, planning the implant. We can look at the bone to implant contact. Then what we can do, we can scan after implant placement and design the temporary, and we can move to the final restoration in some cases. The dynamic one with haptic navigation system, as you see here, you have lifetime camera monitoring the drilling and guiding your drilling to the accurate position to make it parallel to the other implant. And if you see, you can see modifying the direction and the drilling with real-time penetration to the what we can see in robotic surgery here, once you plan the case in the same day, same workflow with the transplant, the CBCT, and scientific position, what you need to do is just take the whole different piece of the drill. You do not change the tip, you cannot change any physical isolation or what position. So you just need to go through that can see consistency in the AI-driven treatment with guided of the jaw relationship or the virtual wax-up before you do the preparation for the teeth, and you can prepare the provisional before the surgery. For lab technicians, AI can help in mapping the shade. So without seeing the patient, you can look at the analysis of the shade and match it to the crown that you have. So you can get 100% replica of the stain and the shade of the adjacent teeth. So we can do virtual diagnostic casts, diagnostic wax-up, virtual implant planning and surgical guides. All of that can be done in-house. You can do the multiple visits with titanium bar or the full arch acrylic restorations or zirconia restorations and dentures as milled in-house if you have the milling machine. So there are some examples of the restoration with hybrid processes or with the full arch acrylic, as you see in this case. And this is needed before the zirconia full arch, so we can evaluate the tooth position, lip support, smile line, everything before we move to the final zirconia full arch restoration, as you see in this case. And with the help of the AI, we are able to correct the angulation of the implant position with the angle solution, so we can end up with full arch zirconia aesthetic restoration without compromising the aesthetic with the screw axis, as you see in this case, as a final results. So AI and the technology is improving a lot, is making our life much easier in the lab side and the technician and the clinician side. Nowadays, with photogrammetry, we can use this machine to do the full arch scanning without having model for multiple cases, especially when you have edentulous. You can do immediate extraction. You can do immediate, provisionalization after the surgery once you place the implant and scan it with the flag, photogrammetry flags. So this is the provisional and final restoration that can be milled and delivered for the patient right after the surgery. So this is the workflow. You can scan the patient intraorally, and once you finish the scanning intraorally, you can remove the healing abutment, and you can use the photogrammetry to scan for your patient. You have to capture at least 3 surfaces to be able to position the implant in the accurate position intraorally. So we don't need to do physical impression with full arch. We can use the photogrammetry to scan intraorally and position the implant with the metric to do the outcome as this with fully digital workflow. What implant is that? So many cases that we don't know what implant is there in the patient's mouth.
Dr. Ahmed, did you hear me? Do you hear me?
Yes, now.
Okay. Actually, it is very nice presentation. And we have a lot of lectures to be presented. How many time you would like to finish your presentation?